Theresa Haselmayer, I know I'm butchering your name. How are you?
I'm good, thank
Good.
you.
Welcome back to the Tick Bootcamp podcast.
I'm thankful to be here, thank you.
So talk to us about ILADS and why you're here at the ILADS conference.
Yes, this is, the fifth or sixth one I've been to over the years. I've been doing this for about 8 years now. I just love to come here and learn. When you work in this space, you need to always be learning. You need to stay on top of things.
And you want to build a toolbox for the patients that you're working with.
That's right.
So you're a traditionally trained nurse. You're an RN.
Yes.
And you also now have your own business. So first, introduce your background to our folks.
Okay.
And I can remind everyone you've been on a long form version of our podcast.
Yeah.
But give us some of your background and talk to us about the work that you're doing now.
Yeah. Well, just working in various hospitals, home care, just all different facets of medicine for 30 years. But I crossed over.
You started right after elementary school, right?
You're so nice. I crossed over when I was so sick, became so sick for 15 years, and, the system that I served didn't help me get better. And once I discovered that actually holistic healing worked for me, and I got fully better from Lyme disease and mold illness and environmental toxicity, I became so passionate about it that I enrolled in a course in New York with Hilary Thing in the Hudson Valley and studied with her for 5 years. I worked with her, and now I have my own practice in Cincinnati, Ohio, and now am being joined by a nurse practitioner, Jamie Rui, so we're now integrative. We're not just purely holistic anymore, we're an integrative practice.
Let's build out that piece that you just shared with us, which is the system that you were educated and you were working within did not serve you. In fact, you couldn't even serve yourself. You were sick for 15 years and you couldn't diagnose your own illness despite being in your own skin. So talk to us about what the failures are in the educational system that you were brought up in and the failures in the training that you received working in the field for as long as you did before you finally got a diagnosis.
Well, I think it's just the business side of things. When a doctor has only 11 minutes to see you and they can only treat the test, right? Those two things alone, I think, are preventing the diagnosis and treatment of, quite frankly, millions of us out here. And I think I don't see any malice or any nefarious purposes. It's just the way the system works financially.
Well, but it's a system that's designed to treat people with acute illnesses, not with chronic illnesses, right? So we really just have an acute care system.
We have an awesome acute care system. Yes, we do. But when it comes to chronic disease, the education is just not there around tick-borne diseases or about environmental toxicities or mold illness. So they just don't know.
So do you think the education is not there because we are educating people to be acute care professionals, and as acute care professionals we're limiting the focus to that type of a business model, or are there other things going on? Because we know we are not being, or not we, I'm not a medical professional, medical professionals are generally not being given the training for preventative care. They're not being given the training for chronic care. It really is just sort of that narrow space with acute care, and then when you add an additional overlay of the specialization that we have where we're now asking those of you who are practicing within the acute care arena that you're also going to be specializing, so the prism that you're going to be using is going to be very limited. Give me a take on that sort of overlay.
Yeah, I think the education is for sure slanted towards acute care, but I would say that most medical professionals would say, of course we treat chronic illness with medications. And so, when that is your main tool in your toolbox, when you're not educated around root causes, well, what's causing this chronic illness, and the research is out there. There's plenty of research. I am certified with the Environmental Medicine Institute, too, as an environmental medicine practitioner. Dr. Lynn Patrick and Dr. Anne Marie Fine. So, the research is there. It's on the government website. But when you're not trained to know about the research or look at it for yourself, root causes are not really on your radar screen. It's more, can we diagnose? Can we give this diagnostic code which fits the insurance reimbursable algorithms? And can we give you the appropriate pill? And that's sort of that's the chronic care that they do, give us.
Well, again, and we could debate about whether or not it really is chronic care or it is not chronic care, but another one of the challenges that you just brought up is this sort of speed dating model that we have to use when we see our practitioners. And I have a brother who's a physician as well, and he's always frustrated by having 15 minutes or less to diagnose and treat a patient, right? So when we have only 15 minutes because we're trying to open up the system to everyone without having a large enough group of healthcare professionals, we are sort of limiting our ability to properly diagnose and treat these illnesses. So why do you think again, and I don't want to go all conspiracy theory here, but why do you think that we are limiting our physicians and healthcare providers to a 15-minute window, and we are only training them to treat acute illness? Do you really think it's because the medical industry is controlled by the pharmaceutical industry? Is it just the model that has been created so that we can treat the largest spectrum of people? What is your perspective on that?
It is the business model. That's what makes the financial wheels turn. And you need the financial wheels to turn to pay for your physicians' salaries and all the buildings and all of the admins, et cetera. So it's a business model.
So how has your business that you've built now made changes in the flawed system that you were trained in and you had worked in before you were sick?
Yeah. Well, for number one, we have 90-minute visits and 60-minute visits and sometimes 30-minute, depending on the needs, because you need that time to really talk to somebody and dig into their story and ask about all the details. And if you don't have time to do that, how can you ever know? So, and then because holistic care gave me my health back, it's something that I, of course, now believe in. And I have, certified training around as well and experience. And I love herbs. I love herbal medicine in particular. We love liposomal essential oil blends in our business because in 2018, Dr. Ying Zhang, you're probably familiar with that research.
When he was at Hopkins?
Yes. And I was actually at the conference when he presented that research. It was thrilling. I was in Baltimore at the time. And they found that essential oils of garlic and clove, cinnamon, oregano, frankincense, myrrh, lithium, chang, allspice, there's a whole list of them, outperformed antibiotics for persisters, for round bodies, and for resistant forms of Borrelia. And so at that conference, everyone was very excited, but I thought, well, who's going to do anything about this? Because you can't make any money on a natural substance. But
at least pharmaceutical companies
right? Yes. And so when I went to Hillary's clinic in 2019, she and Greg Lee, I think had learned from Greg Lee how to spin those oils into liposomes, into phospholipids, phosphatidylcholine. And so those little fat bubbles deliver those essential oils very potently, safely, and effectively. Just tiny little fractions. We're not talking about unsafe levels of essential oils, tiny fractions of drops. But the liposomes deliver them so potently, they just get across all those barriers in the body. They're protected from the enzymes and the stomach acids, and we have seen in the last 5 years we've been using them, we have seen them outperform antibiotics without the side effects. Stephen Herod Booner said it best, nature fights nature best. It's intelligent medicine, and I love it.
So let me ask you one more question before I let you go, and you've been very generous, and of course every time we have one of the folks who have been on our long phone podcast, we find it frustrating we can't ask all the questions we'd love to ask.
Right.
Let's talk about, before we get to the phase of killing the microbes that are causing us to be sick, of course we do have to we have to prepare our immune system, and we have to detox, and we have to be in this prehab phase, is what we argue at Tick Boot Camp.
Yes.
So talk to us about the training that you have in environment. It was environmental medicine. Is that what you described? Is that training also designed to help you to prepare people before the kill phase, so that they can you can determine whether or not they have mold toxicity, or they have heavy metal toxicity, or any other challenges that are weighing down their immune system's capacity to kill these microbes?
Absolutely. Clean air, clean food, clean water, is so important, and we work with all of our clients on just keeping anything that's inflammatory out of your body. Also identifying what are your ongoing exposures. So we spend a lot of time really delving into the patient's story about that. We offer urine testing, blood testing to look for these things so that they can identify, do you have a high load of radioactive uranium? You wouldn't believe how many people do. And mercury, and lead, and mold, and plastics. Plastics are a big one that we find in a lot of people, and when those things create this ongoing inflammatory burden in the body, of course, tick-borne infections just take advantage of that. And so yes, you absolutely have to work on that, and we do work with people with saunas, foot baths, binders, clean diet, getting your bowels moving, supporting your liver. All of those things are critical for success.
Well, thank you so much for taking time for talking with us here at the ILADS conference, and thank you for doing the work that you do. We always want to make sure that we thank folks who are professionalizing the Lyme treatment community, and we can't thank you enough for doing all the work that you do.
Well, thank you.